In terms of public attitude about workplace wellness programs, this is something we asked about a year ago in our Kaiser Health Tracking Poll. We found overwhelmingly that the public thinks it is appropriate for employers to offer wellness programs that promote healthy behaviors. But by large margins, the public thinks it is not appropriate for employers to ask workers to pay higher premiums if they don't participate or if they don't meet certain health targets. On the question of whether wellness programs actually produce cost savings, health cost savings, RAND said that they can, and they observed healthcare cost savings of $30 per member per month on average. But that was not across the board. RAND found that almost 90% of cost savings were associated with wellness programs that included disease management components, which improve the care for people who already have chronic conditions, as opposed to lifestyle programs that prevent the development of health problems and chronic conditions. RAND also studied the effectiveness of incentives and on average observed that the use of incentives does increase participation in wellness programs by about 20 percentage points. But RAND found that designing more comprehensive programs had nearly the same effect without the use of incentives.
When you say what do consumers want, they really want you to make it easy. The consumer expectation around the experience is driven by what they do in their everyday lives, how they shop for Amazon, how they shop at Zappos, how they now hail a cab with Uber. I mean, that the consumer experience is really high in terms of what the expectation is in the non-health world. So when they kind of gravitate to health and wellness, that experience isn't up to par. So there's a lot of work to be done to make things easy, make it personal. That means make it meaningful, make it relative to me, make it move me as an emotional element, right? So that in order to become, to drive engagement, to drive better meeting in context, we have to think of ways of making things more emotional for the consumer so that they enjoy and they really get motivated by what they're using.
The more central aspect to the recent EEOC regulation is the provision governing medical inquiries. The ADA contains extensive provisions regulating how employers can ask questions of their prospective or current employees about medical conditions. And there's a reason for that, which I'll talk about. But the central prohibition for existing employees is that an employer can't ask questions of an employee about medical status unless doing so is job-related and consistent with business necessity. This has been regarded by many employers as a substantial obstacle to engaging in workplace medical inquiries, and so there's an exception that was written into the ADA in 1990 because wellness programs existed then too, which says that if an employer provides voluntary medical examinations or voluntary medical histories as part of an employee health program available to employees at the work site, then that is exempt from the ADA's restriction on medical inquiries of an existing employee. So the basic question that this raises for wellness programs is, are wellness programs voluntary? I think a fair question to ask is, if you are a person who is working for a living paycheck to paycheck, and you are told that you are going to have to pay an extra $1,800 a year out of your pocket if you don't submit a health risk assessment, is that a real choice? Is that a meaningful choice that you get to make? Is that something that we would call voluntary? Under prior EEOC interpretations, as Karen pointed out, that would not be understood as voluntary, going back to 2000. But under the new EEOC proposed regulations, it would be.
There's a lot of misinformation out there as far as who gets access to the information that is reported on these health risk assessments and through these workplace wellness programs. The employer does not get this information directly, and I hope that Dan maybe can speak a little bit more artfully than I can, but or perhaps Sam or Karen, there are some very concrete walls and firewalls of protection that prevent that information from being distilled up to the employer on an identifiable basis. So while I understand the fear is very, very real, I hope that through panels like this and others, we can educate the community to understand that that information is not given to employers. It's often not given to the insurers. It's typically given to a third-party program director that manages these workplace wellness programs, number one. And I think, number two, one of the whole struggles between voluntary versus penalty versus incentives is trying to find that sweet spot as to, well, what constitutes an incentive, what constitutes a penalty, and what amount is coercive and what amount is voluntary. And I think, that's a tough question.